We are right on the edge of a total revolution in medicine, and it's not being driven by some new pill or a fancy surgical tool. It's being driven by code. Yeah, artificial intelligence is walking into the clinic, and it's promising to completely change how we diagnose, treat, and even prevent disease. But as you can imagine, with that kind of power comes a whole lot of complexity. So let's break it down. Let's look at the incredible promise and the hidden perils of AI in healthcare. So, first things first. Why do we even need AI? What's the problem we're trying to solve here? Well, it turns out healthcare is facing this absolutely massive challenge: preventable medical errors. It's a problem that touches millions of lives and, you guessed it, costs billions and billions of dollars every single year. And one of the biggest culprits? Medication. Think about this number for a second. 1 in every 30 patients. According to the World Health Organization, that's how many people experience some kind of harm related to their medication. That's a huge rate, and it just goes to show you the vulnerabilities that exist even in our most advanced healthcare systems. And the financial cost? Oh, it's just as mind-blowing. The global cost of these medication errors is pegged at around $42 billion a year. And that number doesn't even get into things like lost wages or, more importantly, the very real human cost. This is a massive, expensive, and deeply personal problem that's just begging for a new way of thinking. Okay, so that's the problem. And this is exactly where AI enters the picture. Now, the goal isn't to replace doctors, not at all. It's to give them a powerful new partner, kind of like a co-pilot that can see things, connect dots, and work around the clock in ways that, let's be honest, humans just can't. So the engine driving this whole thing is machine learning. To put it simply, it's all about training computers to learn from just insane amounts of data. We're talking patient records, lab results, clinical trials, you name it. The idea is to have them spot these really subtle patterns that might signal a problem or predict what's going to happen next. It's like a digital detective that just keeps getting smarter with every single case it looks at. And listen, this isn't science fiction. This is happening right now. Over at UC San Diego Health, they have an AI algorithm that's monitoring over 150 different things for every patient, all in real time. As Dr. Gabriel Wardy puts it, it's like this silent, constant watchguard for sepsis, which is a really dangerous, life-threatening infection. And the results? What happened? Well, this AI tool led to a 17% drop in deaths from sepsis. 17%. That's the life-saving potential we're talking about, having a vigilant AI partner on the team that can catch those early danger signs before they turn into a full-blown crisis. And its reach goes way beyond just sepsis. I mean, right now, today, AI is predicting harmful drug interactions before a doctor even writes the prescription. It's looking at x-rays and scans with, frankly, superhuman accuracy to find tiny things the human eye might miss. It's helping create treatment plans tailored to your specific biology, and it's even automating all that boring paperwork to free up doctors and nurses to do what they do best: actually take care of patients. So this all sounds pretty incredible, right? Like a digital guardian angel for every single patient. But this is where the story takes a little bit of a turn. If this tech is so revolutionary, what are the hidden risks? I mean, what could possibly go wrong? Well, every powerful tool has a downside, and for AI in medicine, the risks can be as subtle as they are serious. So now we're moving into the part of the story where that incredible promise starts to meet some very real and sometimes totally unforeseen peril. And here you can really see that central conflict laid bare. On one hand, you've got these huge advantages: better accuracy, way more efficiency. But on the other side, some pretty profound risks. You've got the danger of doctors becoming too reliant on the tech, maybe letting their own hard-won clinical skills get a little rusty over time. And then there's the whole erosion of trust if patients start to feel like a machine is calling all the shots. One of the biggest hurdles is something called the black box problem. Just imagine you're a doctor, and an AI recommends a pretty risky treatment, but you can't figure out why. The algorithm can't explain its own reasoning. That puts the clinician in a totally impossible spot, and it really undermines the whole foundation of making informed medical decisions. And then you have an even more sneaky risk: algorithmic bias. See, an AI is only as good as the data you train it on. So that data doesn't properly represent certain groups of people, the algorithm will just learn the biases that are already there, and it'll bake them right into its logic. That could lead to worse care for communities that are already marginalized. It's a huge problem. So All of this really brings us to a critical question. With these incredibly powerful, super complex, and potentially flawed tools being used in our hospitals, who's actually in charge? Who is minding the algorithm?
The answer, really, has to be governance. Just like we have super strict rules for new drugs and medical devices, we desperately need clear rules of the road, guardrails, for the safe and ethical use of AI in our healthcare system. But here's the really alarming part. A 2023 survey found that 84% of hospitals do not have any system-wide policies for governing AI. The technology is just racing ahead while the oversight we need to make sure it's used safely and fairly is just lagging way, way behind. And this isn't some future problem. This is a gap that exists right now. And building those guardrails, it's a monumental job. I mean, we have to figure out how to protect sensitive patient data, decide who's legally responsible when an AI messes up, rigorously test these models to root out bias before they ever see a patient, and, design systems that actually help doctors instead of just burying them in a million meaningless alerts.
So where does all this leave us? Is it some kind of battle of human versus machine? Not at all. The future isn't about replacement. It's about partnership. And this, right here, is the single most important thing to take away from all this. The goal of AI in medicine isn't to make doctors obsolete. It's to enhance their skills, to free them from the tedious stuff, and to give them insights they've never had before. The whole point is to create a true human-machine team. And in this partnership, each side brings something totally irreplaceable to the table. The human clinician, they bring empathy, that intuition that only comes from experience, and the ability to build trust with a patient. The AI co-pilot, on the other hand, delivers its own unique superpowers, processing massive data sets in a split second, monitoring patients 24/7 without ever getting tired, and catching those subtle patterns that can lead to a life-saving diagnosis. See, each one makes the other better. So let's end on this thought. The technology, it's going to keep getting smarter, no doubt about it, probably at a speed we can barely imagine. The real challenge for all of us, for doctors, patients, and policymakers, is to make sure that, as it does, our healthcare doesn't just get more powerful, but that it actually gets fundamentally wiser.